Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and inspire joy. Be empowered to balance your mental, physical, financial, aspirational, and social health while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. If Joy, and I'm here to help you transform life's challenges into opportunities for joy. Let's begin the journey together. Hello, welcome to episode 161. Could your feet be stilling your joy? And I have an awesome guest here, Dr. Ashley Varner, doctor of podiatric medicine. Welcome.
Thank you.
Glad to have you. And for those who know me personally, I know Dr. Ashley from college, University of Michigan. So it's really nice to connect and have you on.
Yes. So glad to be here.
Yes, and we're talking about feet because, Journey to Joy Live, I always find different topics, how to connect back to joy. And our feet are super important, especially for me as a runner. Like, literally, my feet are my source of joy. So anytime I feel like, is there something wrong with my feet? Like, I go crazy in my head because I'm like, does that mean I can't run anymore? So definitely wanted to bring this to this platform. So tell us a little bit more about yourself.
Sure. So I agree with you. Our feet are our foundation. And when our feet are off, everything is off. But a little bit more about me. I am a practicing podiatrist in the Dallas-Fort Worth area in Texas. We have 4 offices that kind of span across the Dallas-Fort Worth area. And then I'm also the founder of True Step Collective. It's a wellness coaching program where I help people specifically with the condition of plantar fasciitis, which is by far one of the most common foot problems that I treat as a podiatrist on a day-to-day. And so I wanted to create True Step so that I can take what I have perfected over the last 10 years and bring it to people that may not be in my community. And so I have various programs, various products that just meet people where they are and help them get over that condition. Because when I tell you, when your feet are not good, you're not good. And it steals so much from you. It's more than just physical pain. It's disruptive. And it prevents you from showing up, doing what you need to do, whether you're a mom, a business owner, a runner, it takes all these things from you. And so I want to make sure that people can maintain the life that they want and that they've worked so hard to create for themselves.
Exactly. So how did you get into podiatric medicine? I mean, a lot of people, when they get into their fields, it's because they had a personal experience or family experience or something like that.
Yeah. So honestly, I remember the profession because I had a family member who had a lot of foot problems. So I actually remember going to the doctor with her. But it honestly wasn't until the end of my time at the University of Michigan that I actually decided to do it.
Yeah.
I was initially interested in more pediatrics. And so when I spent some time with it and I go, you know what, I don't know if I can deal with sick kids every day. You know, you got to be a special person to do that. And so they actually had a class that you can take that helped you figure it out. So I took that class. And one day they brought in a podiatrist and I go, you know what? She's doing all the things I'm interested in. A little clinic, a little surgery. Yeah. Her schedule is really controlled. And so I spent about 2 months with her and chose the profession.
Plus is less time because is it 4 years or how long is the training?
4 years of medical school and then 3 to 4 years of surgical residency after.
It's the same. Okay, I'm thinking it's a little easier. It's just more specialized, but same amount of time.
Yeah.
Okay, but at least on the end, when you go on the outside of it, it's a nice outpatient, get a little procedures in so you can make more money that way. So, and it's a good work-life balance, sounds like.
Absolutely. And the good thing about it is you can really make it what you want. So I have some of my colleagues who don't do surgery at all. I have some that don't do any clinic. They're in the OR 100% of the time in the hospital. I do a little bit of both. I still do surgery every week. I still have clinic. I used to take call. I've kind of backed away from that a little bit. But you can kind of make it what you want. And
That's
that's the beauty
cool.
of the profession. Yeah.
That's real dope. Well, you mentioned plantar fasciitis, so we probably should
Yeah.
talk about that. What is
Yes.
it? What are the signs? How would I know if I had it?
So plantar fasciitis is one of the most common foot problems that I treat as a
Mm,
podiatrist. And some new statistics came out that kind
mm.
of blew my mind. And so the statistic is this: they said that 80% of Americans
Oh,
will
wow.
have foot pain at one point in their life.
Yeah, it's a lot.
And 50% of those 80% is going to be plantar fasciitis. So plantar fasciitis is a
Mm,
condition that happens to many different people and at different phases.
yeah.
But essentially what happens is the plantar fascia is a band of tissue that runs on the bottom of our foot. So
Mm-hmm.
these are your toes, that's your heel. It runs right here. And so
Mm,
it has a couple different jobs. It helps maintain our arch. It helps with walking. It helps lift the heel off the ground. But what can happen is that plantar fascia can become irritated.
yeah.
And when it's irritated, it becomes stiff. Now, a
Mm,
healthy plantar fascia is like a rubber band. So when you
mm-hmm.
step down, it stretches out. When you're not on it, it shrinks back. But
Yeah.
when it's stiff, it becomes like a rope. And so what
Mm,
happens is each step it's pulling on this attachment on the heel bone. And
mm,
typically people will experience pain right there on the bottom of their heel. Now, the
mm.
infamous heel spurs that everybody's so scared about
Mm-hmm.
comes from repetitive pull from that plantar fascia. And
Oh,
so, typically, the common symptoms that patients have are those
yeah.
first steps in the morning are very, very painful. Um,
Wow.
and once you get moving, it kind of eases up and then it hurts more at the end of the day.
Mm-hmm.
Sit down for a little bit and then go to stand up. It hurts because what
Yeah.
happens is when you're not on it, that plantar fascia shrinks.
Mm-hmm.
When you go to stand up, it's got to stretch back out. But remember, it's stiff
Yeah.
because of the inflammation that's in it. And so it's a very, very treatable condition.
That's
But
good.
the biggest problem that people have that I found is they treat the symptoms, but they don't treat the reason why they developed it in the first.
Yes,
So they
that
get
makes
stuck.
sense. So what are the causes? Because that's a good point. It'll come back if you keep doing those things.
Absolutely. So I found that there's about 5 different causes for
Oh,
plantar
wow.
fasciitis. So one of them is biomechanical. So it's
Mm,
how your body is functioning.
mm,
And it may not be at the foot level. It could be coming from the ankle, the knee,
mm.
the hip. All of those
It's
things
all
are
connected.
connected. It's the kinetic
Hmm.
chain. And so something could be off along that chain that's
Yeah,
putting more strain on that plantar fascia.
yeah.
The second common cause that I see with this condition is inflammatory conditions. And so people that have a hard time controlling inflammation due to maybe an autoimmune disease
Mm.
or us women as we enter into menopause and things like that, our body is aging. We have a hard
Heck
time
yeah.
handling inflammation. And so it just stays inflamed no matter what.
Yeah.
There are some neurological things that can happen as well because of this condition. Because you walk differently because it hurts, you can flare up nerves in the area, and it's oftentimes mistaken for plantar
Mm-hmm.
fasciitis, but it's not the same thing. And
Mm.
then sometimes people always forget about what's going on the inside of us. So there's
Yeah.
metabolic factors that can contribute to this
Mm-hmm.
as well. So nutrition can as well. Your nutrition determines how your body handles inflammation, how your body heals tissue, all those
Yep.
things. And so if that's off, you just get stuck in this cycle. Um,
Mm-hmm.
and then some people just don't give themselves enough time to actually recover. So they have a recovery deficit.
They're ready to get back on that pavement if they're a runner.
Exactly. Exactly. So those are normally one of those 5 things that
Mm-hmm.
cause it. And most people don't know you have to start there to get better. So what I did was I created a workshop that I do about
Ooh.
bi-weekly where I
Ooh.
actually walk people through this. And
Mhm.
during that workshop, you actually discover what your root cause is. So I
Oh,
have created a tool that in about 15 questions can
mhm.
identify what's actually driving your pain. And then I'll show you what to do with that
What
information.
to
So,
do.
yes.
Yeah, because 'cause I'm
Mhm.
curious. I mean, the nutrition part makes sense. You can kinda, like, change some of that nutrition. The
Mhm.
the biomechanical. That's
Mechanical.
what you said.
Mhm.
How would you treat that or change that? Is it kind of like what you put in your shoe, or is there something something else
Yeah,
you could
so
do?
first you got to identify which part of the chain is off, right?
Yeah.
Is it coming from a flat foot? Is it coming from a
Oh
knee
yeah.
problem? And so once you've identified where it's coming from, it really does take a trained eye to really look at it and
Hmm.
to determine what you need. But oftentimes we do help biomechanical things with custom inserts, with the proper shoes. All shoes are not created equal and needs to fit your foot type, your biomechanical problems. And so
Hmm.
having someone that has the knowledge to be able to choose those proper things for you is how you fix the biomechanical things.
Yeah. Now we'll obviously get into the mental health part, but what
Yeah.
are the physical consequences if you just don't pay attention? You're just like, well, you pay attention, the pain's there, but you don't go get it treated.
So it can really vary, right? So
Hmm.
one, what I find is most people's activities decrease. So then they have weight gain that leads to other cardiovascular issues, circulate. They just it's like a vicious cycle.
Hmm.
And then if you leave it this condition, if it festers too long, then a lot of times you're left with only pretty invasive treatments that need to be done.
Wow. Yeah.
So whether that is something like a corticosteroid injection, or even
Mm.
surgery. And so
Mm.
you want to stop ignoring pain and actually find someone that can help you get over it so you can return back to your life and you're not forced to do something super invasive. This is one of the most
Yeah.
common conditions that don't need surgery, don't need intervention. You just need the right person to show you how to fix it.
You need the
Yeah.
education and awareness about it, right? I mean, just knowing that 80% of people experience foot pain and
Nuts.
that
That number goes
50% of
up
them,
every time. Yeah.
yeah.
Mhm.
So you often getting people that are just so far along in their pain or in their plantar fasciitis, or are they pretty much right on?
I see on average people wait about 3 months before they see me. So what
Okay.
they
That's a
normally
lot
do
for
is
foot pain.
yeah, they visit Dr. Google first.
Mhm. Of
And
course.
they try it on their own. The thing about Google and AI agents, one, they're not your doctor. Two, they can't diagnose you, and they should
Really?
not they I know, we all go there and be like, "Hey, what's going on? I got this. What is this?" They can't properly diagnose you, let me
Yeah,
say
no,
that.
not at all.
And they can't make a treatment plan. I don't know if you saw it on the news lately. There's a guy who's actually suing OpenAI because
Oh.
yes, because he was consulting ChatGPT and ChatGPT told him to mix all these medications
Oh,
together and
come
he ended up
on.
almost dying because he had a PE, had no idea. So he's actually suing OpenAI, who
They
owns
should
ChatGPT.
know. And it even
So
says like it
I
hallucinates
know.
or that can be wrong. Like it says that
No,
at the bottom.
I know. It's not all ChatGPT's fault. Like
Okay.
you
Not
listen to
at
it.
all. It's an AI. They're not the experts. I mean,
Mhm.
I think you go there to like help organize things, not actually do things for you for
And
intellectual.
that's what I tell my clients and
Yeah.
that's what I tell my patients. Like once you get an actual diagnosis and an actual treatment plan, then that's when you go to them and say, "Hey, this is what my doctor wants me to do. These are the stretching and strengthening exercises they want me to do. Can you create me a schedule?" Or can you create some type of tracking device that I can use to make sure I can track my improvement? That's
Mm-hmm.
what AI can be used for, not for
Mm-hmm.
diagnosis and not for treatment plans. Yes.
Exactly. So plantar fasciitis is the most common one you see. What are some of the other ones that you see?
So the second one, especially when it comes to the heel, and I oftentimes see these together, is Achilles
I
tendonitis,
knew
right?
it. Yeah.
So both the plantar fascia and the Achilles both lift that heel off the ground with each step. And that
Mhm.
same overuse that happened to the plantar fascia can also now happen to the Achilles. And
Mhm.
especially if you go too long without treating the plantar fascia, all of that strain that the plantar fascia can no longer tolerate is moved to the Achilles tendon. And so then people now have
Mm.
pain on the bottom and the back of the heel. So
Mm.
it's this domino effect that happens. And so don't wait. Don't wait. Go get
Well,
treated.
Dr. Varner, I promise I didn't bring you on here for a personal consultation, but it just so happens that I've been having Achilles pain in the last few months, but it was ever since because I use Brooks. I've been using Brooks for the last literally 6 years.
Hmm.
And within Brooks, they have different kinds of shoes. So
Yes.
I've got a different kind of shoe because I go after the colors. Like, okay, my favorite, the ones that I usually go have just gray. I'm like, I don't want gray. So I want the hot pink. So I'll get this different kind. So I got a different kind. It was like more cushiony and my
Hmm.
Achilles started hurting
Hmm.
after that. And I was like, maybe I shouldn't use these shoes. So I went back to another shoe, which it got better, but still the Achilles kind of hurts when I'm running. So,
Yeah, yeah. You actually bring up a good point about shoes.
mhm,
Even within a brand, and I agree with you, Brooks is an excellent brand. I recommend them, but there's different styles because there's different foot types, right? And so, depending on the activity that you're doing, that determines what style you need, how much cushion you need.
yeah.
And so, one of the things that can help with Achilles pain is making sure that your heel is slightly elevated in the
Mm,
shoe. So, when you look at the shoe, you want the heel to be higher than the forefoot because what
makes
happens
sense.
is its job is to lift the heel off the ground. But if it's
Yeah.
already lifted, it doesn't have to do as much work. So it all
Mm,
so that is a situation where you can just do a quick shoe test and look at that to determine if that's a good shoe for you or not. Your art
yeah.
type also plays a role because all of those different styles within every brand, whether it's Brooks or
Mm-hmm.
On Cloud or Nike,
Mm.
they all are designed for a very specific foot type. So you have to understand your foot type and then know which shoe you're supposed to get for your foot type. Yeah.
And what are you hearing about on cloud? Because I kind of like flinched at that because I have a friend who started running in those for the first time and had very excruciating knee pain after
Mhm.
just a few weeks. And apparently others have issues with on clouds too.
So On Cloud is not necessarily a bad shoe. It just really depends on your lifestyle and what you're using it for
Hmm.
and what is used to.
Yeah.
So your friend went from a very cushioned shoe to On Cloud, which doesn't have as much cushion. That's going to be
Mm.
a lot of increased shock absorption that either
Mm.
clearly her knee is taking on.
Hmm. Hmm.
So you have to, when you do dramatic changes in the style of shoe, you have to do it gradually. I've seen so many of my patients and my clients develop conditions like plantar fasciitis and Achilles
Mm-mm-mm.
tendonitis because they switched to a zero drop or a minimalist style shoe
Oh,
too
wow.
quickly. And
Oh,
those shoes
wow.
aren't bad. You just have to gradually introduce them to your foot. Yeah.
Gotcha. Oh, this is good information. Well, let's get into how it affects our joy. You were telling me that you're starting to look at that and how the emotions and emotional wellness of your patients is affected by their feet and by pain. What have you seen walking into your door or with the workshops that you're doing as far as like how it affects someone mentally?
Honestly, this that right there is the reason why I decided to actually start True Step. It
Mm,
started this year. At the beginning of the year, I had a patient come to me in my clinic,
mm,
and she came to me for plantar fasciitis, and
mhm,
she had had it for about 6 months.
mhm,
And her neighbor was actually a patient of mine, and she was trying to follow the treatment that I gave him, and it wasn't working. And I
mhm,
was telling her, this is a very unique. Your treatment protocol is unique to you. And so
mm,
as she was sitting there, she began to cry. And it
mm,
wasn't because she was in physical pain. She was crying because in that moment she realized what this had stolen from her.
mhm,
She had recently retired and she had worked really hard to establish certain things. She was
mhm,
an avid pickleball player. Now I don't
mhm.
play pickleball, but apparently
It's
those that
fun.
do are very serious about
Yeah,
it.
they are.
And she couldn't play it anymore. She loved walking her dog. She couldn't do that anymore. She had gotten
Mm,
invited to go on a cruise, and she decided to against it because
mm.
she didn't think her feet would be
That
able to
hurts.
make it. And she began to cry, and in
Yeah.
that moment, it really dawned on me. I was like, "This is more than just physical pain.
Mhm,
This is a disruptive condition, and it's
mhm,
people from doing the things that they need to do, that they wanna do, and that they love to do." And
mhm,
so that's in that moment, I said, "You know what? I need to take this outside of my community and bring it to other people who are dealing with this that want their life back. Yeah.
Yes. I mean, obviously we need every part of our body, but our feet, like that literally is a vehicle that gets us places just in general. But if you have extra things you like pickleball or running or being able to walk long walks on the cruise or on the beach, and it stops you, it's just like, what are you going to do? And of course, there are so many people, without feet that get around life, but obviously for us who we still have our feet, right? It causes, it's debilitating. I even actually, because I do on call, I do a consult liaison psychiatry too. And I had a patient who they called me, they wanted me to see if he had capacity because they're like, well, he's declining his foot surgery. He's supposed to have his foot amputated because his diabetes is too debilitating. And so they're like, he's declining it. So you have to check his capacity, but he must not have capacity to decline this procedure. I'm like, huh? So I interviewed the guy. He's just like, he shows me his fingers. He's like, I already lost my fingers to diabetes. I don't want to lose my foot again. Give me a chance to think this through if I really want to lose my foot or not, right? So I'm like, this guy's legit. He doesn't have any loose screws. I don't know why they want to consult me on that. But anyway, it's like you have the right to like be in love with your feet and try to figure out, do I want to lose this or not? So, that's a whole nother thing, right? This is why we need to make sure our diabetes is under control, as a side note. Right. But at the same time, it really does affect our joy and mental health for sure.
Yeah. And not ignoring the signs, because plantar fasciitis, although for some people it may seem like it came out of the blue, you have warning signs before then. And we push through, right? We're busy people. We have many responsibilities, and we don't take the time sometimes to listen to our bodies. Pain, as much as we don't like it, is a signal. It's telling us something is wrong, and we have to listen to it, and we have to not ignore it anymore. And so that's how you can take something as simple as plantar fasciitis and catch it early, fix small things, and get right back to your life.
Yeah.
Your life. Yeah.
Yeah. Now, for those listening, obviously they need to go see a podiatrist if they really need to. But and as far as like for people who are like, well, how do I know I need to see a podiatrist? Obviously, it sounds like pain when walking or pain without walking is worse, right? But what are some other signs that they need to go see you?
So this is where you always get to a point. So if you've been trying some things, meaning you've Googled it, you've consulted your AI doctor, and you've changed your shoes, maybe you bought an insert, you went on YouTube and found some stretching, and it's not getting better, and you've had this thing for 3 months or going or higher, that's when it's time when you need a professional.
Yeah.
And there are so much information about plantar fasciitis that's out there. When I started True Step, I did some market research, and I go, this is why people stay stuck. It's not lack of information, it's too much information, and it all contradicts itself. And so you need somebody that can look at your situation and be able to create a customized treatment plan for you. Yeah. There's 3 things that I know about plantar fasciitis for treating it for over 10 years. 1, you must know the root cause. Otherwise, you're just treating symptoms and it's going to come right back. 2, your treatment plan must be customized to the patient. It must include your foot type, your lifestyle, and your goals.
Yeah.
So for an example, if I have a person who's a teacher who stands 10, 12 hours a day, their treatment plan will be totally different than someone who works from home who doesn't do much or is not as physical, right? And so they both need 2 totally different treatment plans. And the third thing I know about plantar fasciitis is that you must heal this from the inside out. You gotta tweak your nutrition. You gotta treat and make sure that your metabolic factors are under control, or at least you're working on them to be able to get long-term healing. Otherwise, you'll get everything will be temporary.
Yeah, it's all about what you put in your body for anything, for sure. So let's talk about athlete's foot and toenails. I know that person's watching, so I won't say his name at all, but there might be somebody I'm thinking about when it comes to toenails that may be yellow or have some fungi. And I think that, can be also intertwined with athlete's foot, which is why I brought that up. But tell me about that.
So a lot of times when I'm treating toenail fungus, that person also normally has athlete's foot. And we don't know what starts first. It could have started in the skin and moved to the nails. But I will tell you that the skin is much easier to treat than the nails. The nails take a long time to get better. And there are different things on the market that you can use. But again, if you've tried over-the-counter stuff and it's not getting better, you need to see a podiatrist, right? So we have new treatments out. Like in my practice, we use laser therapy, which is really good. It not only kills the fungus, but it activates your immune system. It's non-invasive. There's medicated foot soaks you can use. There's oral medication you can use. Some people can't take that because it is a little hard on the liver, but sometimes we combine a few things to get you better. But if you've tried the over-the-counter stuff and it's not working, you need to see it.
It's interesting. It just keeps growing back. No matter how much you cut it off, you go to the pedicure. But I mean, is it genetic? Because let's say said person has kids where all of a sudden they're not athletes, but their toenails look the same way. I don't get it.
Now,
I'm not talking about my kids.
Now, there's different reasons why a toenail can have some discoloration to it. So fungus is by far the most common. There are micro trauma. So from wearing ill-fitting shoes that hit that nail can cause it to discolor and become thickened as well. There are some autoimmune diseases like psoriasis that change the texture of the nails. But by far, depending on what it looks like, and there's other organisms that can get in there too. Sometimes I find bacteria in there as well. But again, it's important to get to a provider who can do a nail unit biopsy, send it off, find out what's in it, and so that you can get some targeted treatment to get it better. But cutting it's not going to do it. It's not. It's still there. Yeah.
But I mean, that relates to trauma the same way, teeth, poor looking teeth, you don't want to smile, that kind of thing. And if you feel like your feet not looking good, maybe your feet aren't painful, but your toenails look a certain way. And the beach, you want to wear socks, you don't want to go out. And so then you're sad as people talk about you, if they do, or you think they're talking about you. So that definitely affects your mental health too.
Absolutely. Absolutely. And so, a lot of times we hide, it's real easy to hide in the winter, but like you said, in that summer, you want to be out there, and you wearing socks with sandals, you're going to get attention either way. Right. So I will say this about toenail fungus though. If you're trying to get ready for this summer, it's already too late, because it takes at least 6 to 9 months on the low end.
Next summer.
Clear nail on there. But next summer, you'll be ready. Yeah.
Okay. All right. Well, clearly your feet can be stealing your joy. So, I mean, a few weeks ago, I did an episode basically, why do you keep choosing things that stress you out? And it kind of comes to stuff like this, where we refuse to go to the doctor for whatever physical problem that we're having. So if your feet are painful or you're having some issues with your toenails, why do you keep doing that thing that stresses you out? Because clearly it's affecting you by pain, or you don't like the way your feet look. There's always some type of treatment, sounds like, that can help.
Yeah, there is. Yeah. And it's not always, everybody's always, specifically with plantar fasciitis, everybody's scared of the cortisone shot. Just know there are other alternatives to that. I do a combination of things. I do shockwave therapy, which is really effective to help with plantar fasciitis.
Okay.
There's PRP injections. There's pain laser treatment. So there's a lot of other things that you can do, that a lot of times fear of injection, fear of pain, embarrassment from your toenails keeps you from coming to the doctor. That's what we're there. That's what we're there for. So don't be afraid. If you don't want the shot, tell them, hey, I don't want the shot. There are alternatives to it. If you're afraid to show your toenails, don't worry. It's just you and me in the exam room anyway. Nobody's going to see them.
They're afraid to be judged too. It's like, you didn't do nothing except for just wait to go to the doctor.
I can't tell you how many patients have been like, I got the worst ever. And they take their socks off. And I'm like, no, you don't. Not even today.
It's not even that bad, because you've seen the worst. Exactly.
Yes.
You're like, I seen the worst yesterday. It wasn't you.
Yeah. No.
Don't tell that person. So is there anything, so a lot of times when we're the expert of something, we learn and we do it ourselves. Like I would have to say grounding techniques is something that, I wasn't doing before being a psychiatrist, and now I do it a lot. Is there anything that
Mhm.
you've learned, throughout these 10 years working as a podiatrist that now you do in order to protect your feet?
Absolutely. So, a couple things. We were talking about this a little bit before we started. Is when I travel,
Mm-hmm.
absolutely no barefoot walking for me in those hotel
Oh,
rooms and in the
oh
shower.
yeah.
100% you need to bring a shower shoes. You
Oh,
have
that's good.
absolutely no idea who has been in that
Oh, true.
that bathroom before you got there.
Or how well they
So
cleaned it.
exactly, exactly. So I always
Oh,
bring
shoot.
shower shoes. I never walk barefoot in a hotel room.
Mm-hmm.
Speaking of barefoot, one of the things that I've learned, especially as I'm getting older, is what I wear inside of my house. For a long time, I would just come home, pick my shoes off, and I'm barefoot. But I realized that that was causing some issues for me. So having a
Mm.
supportive sandal that I wear around the house, that's my house shoe,
Mm.
is standard in my house. And so especially on around the holidays when we're standing for hours cooking in the kitchen, things like that.
Mm.
And then the next day I'm sore and I'm like, I was barefoot all day.
All
And so
day.
those
Thanksgiving
little
cooking.
things where you just always have, I'm always very cautious of protecting my foundation, which are my feet. So
Literally your feet.
yes,
Yeah.
yes, yeah.
Ooh,
Hmm.
all of that is great. And so my
Yeah.
mom, she looks every episode, so I know she's looking. So good brownie points for
Hi.
her, right? Hey, she's always looking for different sand. I'm like, lady, you buy a different pair of sandals every week, and it's like to wear it in the house. It's like really thick, and she does not like walking barefoot. She can't walk barefoot, and
Hmm.
she never walks around that. So that is really good
Hmm.
advice. And I'm always taking my shower shoes. I was in Vegas, I was in the Mandalay Bay. That's a really nice hotel. And I saw in the shower, like somebody little blonde hair. I'm like, that ain't my hair. And so
Yeah,
as clean as it looked, I'm like,
yeah,
it's still a piece of hair there. So if the hair is there, something else is there
yeah.
too.
There's this viral video going around right now. I believe it was on a cruise ship. I don't know which cruise
Mm,
line. And
mm.
this lady is sitting in the buffet and she has her leg kind of cocked to the side and she's using a fork to scratch the bottom of her foot. And I don't know if this is
Oh
athlete's foot or
no.
psoriasis. I couldn't tell I
Uh,
couldn't zoom in. But I'm like, that could have been the person that was in your cabin before you.
ew.
And don't do barefoot in, in public places.
Ew.
Pools, wear water shoes, do what you gotta do. But
Mm,
not only is fungus transferred around this time of the year, but also warts.
yeah.
I have an influx
Mm.
in warts in the kids
Mhm,
because they've been
mhm.
all summer and they've been at pools and water parks and warts are rampant around this time. So I have a ton of teenagers and younger kids coming to me with warts. And warts is just a virus
Oh,
that
the
you step
kids
on.
too. My
Yeah.
poor little kids. I need to get them water shoes because we were in an Airbnb in Colombia a couple weeks ago, and I always carry my water shoes. But the kids, I mean, I guess just like not comparing them to dogs, but like you forget that dogs have human issues and
Mhm.
kids do too, obviously.
Yeah.
I just let them run around like their feet to be okay. But now I feel like I need to get them something to walk around
Yeah.
in.
Yeah. Yeah.
Oh, that's great advice.
Yeah.
This is great. I hope somebody's learning something. So at the end of the day, if they're gonna get something out of this, go see a podiatrist. But is
Yeah.
there anything like at home that someone can do if they're having issues, especially with plantar fasciitis? Like, is there a certain kind of exercise, or since it's case by case, they probably should just see a professional first?
Yes, but there are some basic things that you can do
Mm,
while you're either waiting for an appointment or trying to find one near you. So we've been talking about the foundation, and one of the most
yeah.
underutilized things that people don't take seriously is honestly what you put on your feet. So your
Mm,
shoes make a huge difference, and
me
so
too.
there are a couple features in a shoe if you have plantar fasciitis that you want to make sure that the shoe that you use or spend the most time in have. I teach a 5-point shoe test to my clients and to my patients to make sure that no matter what they're doing, their foot is always protected in the right style shoe. So, what you can do to check the shoes to make sure that that shoe is going to be protecting your feet and helping your condition and not making it worse, is to do this quick test. So what you do is you take your shoe and you try to fold it in half. If you can fold it in half and close it like a book or fold it like a taco, that's no good if you have plantar fasciitis. That
Oh,
means there is no support in the center of that shoe, and your arch needs support while you're flared up.
that makes me
The
think
other,
of Chucks because Chucks
yes,
have nothing.
no, no. The other brand too, and people are gonna be mad at me when I say this because they love it. But if you have plantar fasciitis, you got to be careful. Are Skechers.
That
People
makes
love them
sense. I thought
because
you were gonna
they're
say
super
Nike.
comfortable, but
Yeah.
comfort doesn't mean support, y'all. So not all of them are bad, but you got to
Mm.
check them.
And cuteness don't mean support. Last week at the AKA convention, I was buying those blinged out Chucks. And that was the first time I had Chucks. I don't like them. There's no support.
Yeah,
But I'm like, well, it's blinged out. We're going to have a sneaker ball. I need to wear them. And so the first day I wore them, it was terrible, but I wore them anyway. But then
yeah,
the
yeah,
second day, 2 days later, they were fine. So I was like,
yeah.
oh, okay, you just have to break them in. But still, there's no support. So you still have to be careful.
And you know what? And it's not that you got to throw all your shoes away. You just have to be cautious of the shoes that you wear on your high low
And
days.
how long
So,
you were
and
for.
for how long, right? So you can
Yeah.
wear your blinged out chucks when you go out to dinner or with friends, but if you're
Yeah.
not going to run in them, right?
No.
So,
No, no,
so that's the
no.
that's the difference. So I'm not saying throw your shoes out. Just be cautious. Like, hey, I got a busy day. I'm got to pick the kids up. I got to go to the grocery store. I got so you gonna be. You need to make sure that those shoes are going to be supportive for you while
Mhm,
you're doing those things. If you're just going out to dinner with friends or maybe to a movie or something, wear
mhm,
your cute shoes. Wear them,
mhm. It's
but not on
okay.
your high low days. Yeah,
Not on the high low days. Yeah, if you're out dancing, you're not gonna pay attention anyway because you dance and
yeah,
you'll feel them by the end of the night. But yeah, I think so. Yeah, it's like the short term, it's fine, but you're
hmm
not doing it every day, all day, and on high low days, working on your feet all day.
yeah,
So yeah,
yeah.
awesome. Well, I ask all my guests what their personal journey to joy has been like. So, Dr. Vernon, what's your personal journey to joy been like?
I have learned to say no. I've learned to
Ooh.
say no. I was a yes girl for so long. I would
Mm,
just figure it out. And
mm,
I've learned to also, in terms of my career, to have a hard wall on when I go home, Dr. Varner is
mhm,
done and
mm,
Ashley walks in that door.
mhm, no,
And having that hard stop. I used to come home and sit down and do notes for 2 or 3 hours before I go to bed,
mm.
and I was just I couldn't separate work from personal, and so
Yeah,
I've been really working on setting my boundaries with that
good.
and saying no and say, "Hey, that can be done tomorrow." When I
That's
come
great.
home, I'm Ashley. I'm not
Yeah.
Dr. Warner.
Gotta
Yeah.
have those boundaries, good
Yeah.
work-life balance. Even something as simple as just now I was out for a run and I was just walking. So it didn't look like I was running because I was walking in the beginning. And there was like this random guy walking our neighborhood. He was like, oh, excuse me. I was like, we don't have solicitors. And he's like, I'm not a solicitor. I just want you to fill the survey out. I was like, no, I'm working out. And I just kept walking. And I was just like, yeah, because a lot of people feel like they gotta
Mhm.
like answer somebody when they stop you. And it's like, no, you can be
Yeah.
assertive and you don't have to be mean about it, but
Yeah.
no is a complete sentence.
Mhm. Yeah. With
So
no
that's
explanation needed. No.
no explanation at all. I guess I gave one. I'm like, I'm working out. But yeah, thank you for providing it and glad to have you on.
Absolutely.
Talking about could your feet be still in your joy? So if it is, go see someone. So you said you got True Step Collective. That's the one you just created, and the first one was the Podiatry Associates of Texas. The group you said you have.
Yeah. So if you're in the Dallas Fort Worth area, we have 4 offices. We have an office in Farmers Branch. We have an office in Arlington, one in Weatherford, and one in Mineral Wells. I'm not the only doctor at the practice. I am mainly at our Weatherford and Mineral Wells locations. So if you want to see me, but if you're not in Texas or maybe you're in Houston or somewhere far away, you can always
Georgia.
get access to me through True Step Collective.
Mm.
Do a wellness coaching program, and I can help you with your foot problems. I'm happy to help.
Yay. All right. Well, thank you, Dr. Varner. Great to have you here.
Thank you for having me.
All right, everybody, have a good night. This has been an Enjoy Life production. If you're in a crisis, don't hesitate. Call, text, or chat 988 for immediate support. Please note, this podcast is for informational purposes only and is not a substitute for professional treatment. If you're looking for therapy or medication management through Enjoy Life, visit www.drenjoylife.com to request a consultation. I'm licensed in 13 states. I accept Aetna in Georgia, Florida, and Virginia. Be sure to grab your copy of the Enjoy Note to help you on your wellness journey. Also check out Inspire Joy for the wife, mom, boss to help you balance it all without losing yourself. Better yet, get the full Joy bundle for just $45. Remember, Journey to Joy Live is every Thursday at 7 p.m. Thank you for joining me, and until next time, may you continue to transform stress into joy.